Welcome, everyone. I'm Jeffrey Goodman, Director of Marketing and Development for the YMCA of Northwest Louisiana. We're here at 318 Latino Studios for Shreveport-Bossier, my city, my community, my home. And I can't wait to have today's discussion. It's with Mike Nolan. So, Mike, thanks for being here. Really appreciate it.
Well, thanks for having us.
Of course. So, and if I get anything wrong, please correct me, but in May of 2022, Ochsner LSU Health Shreveport started a new program for teens and families affected by gun violence. The program is called Protect, which stands for Providing Resources and Outreach Tools for Every Child and Teen.
That's correct.
Mike, you serve, if I'm not mistaken, as LSU Health Shreveport's Pediatric Trauma Coordinator. And you once said, and I'm going to have several quotes from you through this, but you once said, if you look at all of our patients who are pediatric patients who come in with traumatic injuries, 26% of them are due to firearm injuries. The national average is 8%, so we're more than 3 times the National Trauma Center's average in terms of the proportion of our pediatric patients to come in with gun-related injuries. So let's start here today if we can. We'll get to the details of how the Protect program works. But first, if you could, tell me about the genesis of Protect and how the idea first came about to start the program.
So the idea of Protect literally came from this big increase in the gun violence that has affected kids in our community. We had a few, I think it was 2019, we were seeing it rise, the number of kids affected. But even in that time, there were some that were inside their homes, in their beds, where it's supposed to be the safest place, and they were injured because of gunshot wounds and bullets coming through the walls. It was that time we realized that we have to do something. And that was 3 years ago. Started with just a small group of people sitting in one room, and that's where Protect was born from, was just a few people in that room trying to figure out what to do.
And I read that you had perhaps some assistance from a mentoring facility in St. Louis, and that they've reduced their re-injury rate from 40% down to almost 4% with their program and helped untold members of families. Can you talk a little bit about how you worked with this facility in St. Louis, and how did you first become aware of their program and work in this area?
So because we are a pediatric trauma center through the American College of Surgeons, we're encouraged to join national trauma societies, things like that. And I joined an organization called Pediatric Trauma Society, and went to the convention, and it was a whole lot of people just like me that were running pediatric trauma programs. And a lot of areas in the country are having the same problem, so it was a hot topic there. I met up with this person, and they had been doing it since 2012. And just from the first time we talked, we pretty much developed a friendship from there out, and he turned into an amazing mentor.
That's great. And for the lay person out there who perhaps has never met a young person impacted by gun violence, are you able to paint a picture for me of what life looks like for some of these patients you come into contact with through Protect?
So most of the time when you think about somebody that's been affected by gun violence, you think about the wound, the hole that it made in their body, the injury that occurs. But that is a very big piece, significant piece, but there's much more that goes with it as well. The trauma, the mental trauma, the emotional trauma, the trauma to the entire family. And if we don't address that early in what we call the acute stress disorder, if we don't get that early, it then becomes the PTSD that we're also familiar with. So that's a real key point. One of the big things that we work for is it's a holistic approach to everything, not just their wounds, but it's the aftercare once they leave our hospital.
Perfect. Which kind of brings me to my next question. I've read where you've said that gun violence should be treated as a public health issue and that Protect is taking a public health approach. The program's goal is to heal youth impacted by gun violence by providing resources like mental health services, shelter assistance, and mentoring. Walk me through, if you could, some of the services provided by Protect, and take me through what a potential case may look like and how you would work with a patient.
So the easiest way to explain it is to explain what we mean by public health approach. And that's the easiest way. And the way we do that is we think about a child that comes to the emergency room for the first time ever. They've never been diagnosed with any health problems, but this time they come to the emergency room and they have diabetes. Their blood sugar is super high, and they've just now found out about this new disease that they have. What does it look like for that patient? Well, we fix their problem in the ER. We get the blood sugar down where it's not in a dangerous level, and they usually get admitted into the hospital from there. While they're in the hospital, we're continuing to treat the blood sugar. Dietitians are meeting with the child. They're meeting with the family. They're learning how to eat things that are healthy and keep them from having a diabetic emergency, but still have a life as a kid. We get them specialized physicians, endocrinologists. They're in and out there. They could see the child as well. When it's time for the child to go home, the nurse comes in. They usually have a big stack of discharge instructions of things to do, how to take medications, different kinds of exercise, a complete how to change their lifestyle to prevent them from coming back with a diabetic emergency. So let's just say that same child comes back to the ER 1 week later, but he's there this time because he's got a gunshot wound. He's been shot. Comes into the trauma bay. The trauma team rolls in. They do what we do exceptionally. We call it resuscitating. Stop the bleeding, get them into the OR. We start the healing of the wound. They get admitted. The specialist, if it's an orthopedic issue, they'll see them, but our trauma guys see them and until the wound itself is healed. And then it's time for them to go. The nurse comes in, gives them some instructions. You probably will need to follow up with orthopedics or our clinic for your wound. Here's your discharge papers. Try not to get shot again. They look like two completely different patients, and that's the case across the country. And that's where these programs came from. We want to treat that gunshot wound just like it's a public health emergency or a disease. We need to provide them things that can help change their lifestyle, to alter things, alter their paths to whatever led to this one. We want to change it so they don't come back with the same injuries.
And get into a little more detail around that. Like what are some of the things that you're specifically doing to offer more wraparound care and wraparound service?
So our goal is for every child under 17 that comes in with a gunshot wound, and actually within the last couple of months, any violent injury that's penetrating. So even a stabbing now we're trying to get into the program. But initially, our team will see them, the social work team will see the patient and the family, explain to them what Protect is, and we look for a real quick assessment. Do they have food? Is it constant food? Do they have a place to stay? Do they have a constant place to stay? And do they have clothes? Just basic needs. Once we get the answer to that and do our thing there, then we do a much deeper assessment if they choose to enroll in the Protect program. Then we're looking at all kinds of things with just the patient or the child, but also the family or caregivers. Do they have a job? Does the parents have a job? If they don't have a job, why not? Why not in a bad way, but are there roadblocks or things keeping you from getting a job? So we try to find them help with how to do interviews, appropriate or proper clothes for interviews. There are some education things that we can help them with. Another big piece is the mental health part. And, that's something that's it's hard to get people to acknowledge that piece. Nobody wants to talk about the mental health part, and I was fine when I came in. Yes, you may have been, but it's different now. So that's super important. That's another, we work with a couple of partners that help with that as well. Some of them actually will go into the home instead of the patients having to get to them. We have some that we work with some bill paying assistance if needed. That's what we do, as we're kind of the hub. We connect them with these resources, and we follow up to make sure that they got what they needed from that resource, and if not, where else do we need to go?
And just to kind of close the loop on what you just said, and correct me if I don't get this right, but just like the diabetic patient that you don't want to see again for a diabetic related issue, you don't want to see this patient ever again for a gunshot, and
Right.
You're hoping to provide any kind of assistance you possibly can to do your best at preventing that reoccurrence.
Absolutely. That's what this is all about. I get the question all the time of, we're seeing the patients after they've been shot. How are we preventing? Well, this is not a prevention program. This is an intervention program. We have a whole team that does prevention stuff, but we're an intervention. We have the children and the family in a safe spot. They're isolated from the outer influences that may have a negative impact on them. And it's a teachable moment. So we have their attention then. And so, and that's the whole key, is to give them the skills they need to not come back with a violent injury again, if at all possible.
So I came across another quote from you where you said, we don't have housing for them, for these kids that come in, but if the child or teenager decides, when I get out of school every day, I don't want to go hang out in these same places, where's a safe place for them to go? So now we're partnering with SPAR to get a root in the community to do things like that. I know as a community, we're in need of more mentors and more after school programs for our community. Do you just personally, do you see signs that we're making progress in these areas?
So there are programs out there, but I personally, this is just my personal belief, we need a whole lot more. We need some significant community involvement to mentor these kids, to give them things to do, and even the family as well, the caregivers as well.
No, absolutely. And explain the, no, I actually kind of covered this, but let me, so I know you're providing wraparound services for these gunshot victims through Protect. Can you talk about some of your specific community partners as well as the areas you feel where you could still use additional partners and support with Protect?
So we could use additional support from in all areas. We do a lot of Center for Children and Families. Center for Children and Families. They do a lot of our kind of the mental health piece, addressing the acute distress, just anything. They actually will go into the homes, but they have a group here, and I think a group in Monroe. So it's kind of, we get kids from all over the north part of the state. So that's
Sure.
Anytime we could find more resources, and I think that's a big piece to help with that mental health piece after this would be huge. And even for the kids just in general that are involved in whatever it is that gets them in these violent activities, they just more help after school stuff for sure.
And there's a website for Protect, right, where people can access contact information and additional information?
Yes. You can go to our Ochsner LSU Shreveport website, and it's on that website.
Okay. And I mean, those were my main questions. I just wanted to kind of give people a sense of Protect, but we've got all the time in the world. Are there other things that I failed to ask about, or other important aspects of Protect that you would like to talk about, or your work that you'd like to talk about that we didn't discuss today?
So I guess really the biggest thing is, even when we were working with Josh, that was the mentor from St. Louis, he told us in the very beginning that once we have it up and running and we're running the program, that our success rate in enrolling people into the program was going to be low, and it wasn't going to come up until the entire community was aware of what Protect is. His exact words were, until the matriarchs and patriarchs of the community get to where, if they go to the ER because a family member's been shot, when they get to the point where they're asking, hey, where are those Protect people? He said, that's when you'll start to enroll them. And we actually have seen that. We approach about 80% of the kids. Some come in on a weekend and we might miss them, but we have about an 80% approach rate, but we've just now actually reached the 30% enrollment rate. So it's just a matter of getting the news out there, to where when they hear the word Protect, they already know what it's about. It's just a trust factor right now. That's the biggest thing, is getting the word out there.
And you're still early. I mean, you started it
it's a
little over a year ago, so it's still very much at the early stages, and you are getting the word out more and more.
Right.
I would like to, just because we were talking off camera, and ask you, you're someone who's spent a long time working in trauma. I asked you the question, just, how does someone who works day in, day out in trauma unsee all the traumatic things that they see day in, day out? Can you talk a little bit about how one unsees all that you encounter in your professional life?
Yeah, so I don't know that we ever unsee it all, but like we were talking earlier, the thing that, I don't know what the word would be, but oversees or kind of covers that up, for me anyway, is when I see one of these children that come into the trauma bay, and when I first see them, I'm wondering or concerned that they may not make it. But then I watch that child walk out of our facility, or be discharged home. Those are the things that well override the things that we otherwise see. So that's what it's all, to me, that's what it's all about.
Well, Mike, I think y'all are doing extraordinary work for our community. Anything else around Protect that you'd like to share or mention?
No, that's pretty much it. Anytime that we get a chance to talk about Protect, we'd love to.
Well, really appreciate you being here.
Thank you for inviting us. Thank you.
Absolutely.